This week marks 1 year since the first cases of COVID-19 were detected in Torbay. And what a year it's been. To date, we have some 148 people who have died as a result, and over 4,000 people have been infected. We have to pause to remember those who have lost their lives and those who are grieving that loss in very difficult circumstances where the normal patterns of mourning have been interrupted. But it's also a time for reflection about some really positive things that have happened over the last year. My predecessor, Dr. Caroline Dimond, has written her last annual report on the journey that we've taken with COVID-19 over the last 12 months. And it makes very good reading about some of the things that we've learned along the way, as well as some of the challenges that she's given us for the future as we think about living with COVID as we move at the end of this particular period into a period where we live with COVID and hopefully do not have to fear another resurgence or another wave of infection. This week, we open another testing facility, our community testing facility, which is geared at offering rapid testing to individuals who do not have symptoms of COVID-19. And this is important because we know that 1 in 3 people who are infected with COVID-19 do not have symptoms, but can still transmit the disease to other people without knowing. The facility that we've opened at West Key Car Park in Paynton is geared at offering people who are unable to work from home, who are working in face-to-face roles, the ability to be tested up to twice a week, that they can identify whether they are infected and therefore can isolate, as a result, prevent transmitting the illness to others, particularly in their workplaces, for example. There is information on the Torbay Council website as to how you can book and the groups of people that we're giving priority at this time as we're starting community testing for asymptomatic carriers of COVID-19. In time, we hope to be working with some of our larger employers to offer testing, and we hope to have facilities available in Brixham and in Torquay as well. The vaccine program continues to roll out. We are very pleased with the progress that we're making to ensure that the most vulnerable, those who are likely to have more severe illness should they become infected, are gaining some protection. And we know that many of those groups, including those in care homes, over 90% have had their first dose, and second doses are beginning to be rolled out as well. And that's a very positive thing, and certainly a very different situation than we had when we started dealing with COVID a year ago. It's important as we look to the easing of restrictions to recognize that some of the public health measures about preventing the transmission of this disease are as relevant now as they were last March. The disease is spread from person to person, and the way to interrupt that spread is to reduce as much as possible interactions with other people, particularly those outside of our household and outside of our support bubbles. When we do have to interact, then it is important that we maintain social distance as much as possible, that we wear face coverings when we are in contact with people and where we cannot maintain that social distance, and that we wash our hands as often as possible to prevent any transmission from touching contaminated surfaces. It's doing all of these things together that has made a difference. And it is doing these things that will allow our vaccine program, for example, to have the success that it needs to have for us to be able to emerge from this lockdown and remain out of those excessive restrictions. It's also important to remember that a lot of positive hard work has gone into getting us to this place, and we need to maintain those gains. As I close, I want to pay tribute not only to the brilliant work of our NHS colleagues, the work of those who are working in the care sector, the support that have been provided to our schools, to the care homes, to businesses and workplaces by public health workers, both in our own council, in our public health teams, as well as the National Public Health England NHS Test and Trace, but also to think about the work done by volunteers. And I'm thinking of Torbay Community Development Trust and their helpline, bringing together some 60 voluntary organizations, and over the last year, over 1,000 volunteers, over 3,500 people have been helped in very practical ways to self-isolate. Some of our clinically extremely vulnerable have been supported through the voluntary sector as well as through the statutory sector, through the council and others. It's been a year of up and down, but mostly it's been a year that has shown great resilience in the people of Torbay. And that gives me confidence that as we move forward, that kind of community spirit, that coming together, doing the right thing to protect ourselves and others will keep us in good stead and will make sure that our numbers continue to decline and that we're able to keep them low well into the future. And so with that, I hope that the next year will certainly be far more positive than the last one, and that we will build on all the valuable lessons that we have learned, and that we will learn to live with COVID without fear. Thank you.